Within the picture or the universe of home care is a home health aide, a largely understudied population. The focus of this study was to develop home health aide-informed care plans. Prior researchers have focused a lot on skilled clinicians, such as nurses and therapists, but in the home health care setting, it's not a nursing home and it's not a hospital, right? The person who stays with the patient is not the nurse, it's the aide. 3 million Medicare beneficiaries receiving home health care every year is serious. Home health care is a rapid and critical growing component of the US healthcare workforce. During the pandemic, while there was lockdown, aides were locked down with their patients in their own homes. And infection prevention and control, contact matters. Yet, the larger research community was really focused on the nurse who makes visits for like 20, 30 minutes and leaves the patient with the aide who spends about 4 hours, 6 hours a day. Not much is known about the home health aide, but this study has not only focused on the personal care of the older adult, but the contribution of the aide to enhancing infection prevention and control in the home health care setting. Our findings about being isolated from the larger home health care team, about challenges with PPE, about the fact that they had to use their personal funds to buy PPE, and challenges around information control and disparities in information control for Spanish-speaking home health aides with limited English proficiency are priority concerns from the larger research community. Because think about it, with so much shortage of nursing workforce during the pandemic, there was a shortage of workforce to supervise the aides, provide them the kind of support they needed, backup kind of information they needed to understand from an infection prevention and control standpoint how to protect themselves, how to protect their patients, and the appropriate measures to take on a day-to-day basis. We found in our study that many of the Spanish-speaking aides with limited English-speaking proficiency were really sourcing information about the pandemic from their iPhones, from their local radio, from their local TV channels, just to get themselves more up to speed with what's going on, which is not what we expect in a home health setting. The flow of information about the care of a patient, about infection prevention and control should happen between the nurse and the home health aide. So these structural and system level shortages and challenges significantly impact the delivery of care for the aide. The home health aides are the voices of our patients in the community. It's important that we listen to the voices of our patients in the community directly, but it's also important for us to listen to their voices indirectly. They spend the largest amount of time with our patients. It's necessary to build collegial relationships with aides. Many other researchers besides me have identified themes that we identified in our study, and those are themes of isolation from the larger home health care team. The nurse-aide relationship is necessary to close that gap. One thing that the study raises attention to is the need for huge investment in home health aides and even greater investment in home health nursing as a workforce. Investment in their training, investment in the specialization of nurses in home health care specifically, to ensure that the needs of aging Americans who have chosen or made preferences to age in their own homes are respected, honored, and supported under the Medicare home health benefit. There is no doubt that new knowledge, new information, and new innovation is happening right here at Adelphi with our Home Health Care Institute that provides a learning lab that's completely configured to simulate a home health care setting. Clearly, there is no dispute that we are a leader in home health care. We are constantly engaging in groundbreaking research and creating new innovations about how to improve the delivery of home health care and improve the outcomes of the homebound older adults. Our commitment to strengthening the home health care nursing workforce is clearly a priority.